Progress Report 2012, Healthcare Renewal in Canada, an address by the Chair of the Health Council of Canada, Dr. Jack Kitts.
In last year's Progress Report 2011, we reported on 5 healthcare themes from the Accords: wait times, pharmaceuticals management, electronic health records, teletriage, and health innovation. This year, we are reporting on progress on 5 other Accord themes: home and community care, health human resources, telehealth, access to care in the North, and comparable health indicators. I will now provide a brief overview of what we found on each of the 5 themes. The first is home and community care. Now, many provinces and territories have moved forward in expanding home and community care services. However, there is marked variability in access to home care throughout Canada. Many jurisdictions had already met their commitments before they were formalized, which perhaps served to create a minimum threshold for performance, but did not level the playing field. As a result, while many provinces or territories have moved forward in providing more home and community care, others have not gone beyond the original commitments. As we noted in our recent report on home care, seniors in need, caregivers in distress, Canadians would benefit from expanded efforts to integrate home care with other services in the healthcare system, particularly with hospitals and primary care. 8 jurisdictions are using or will use the RAIHC, R-A-I-H-C, which stands for Resident Assessment Instrument for Home Care. This is a standardized clinical assessment designed to evaluate the needs of clients requiring home care for long periods of time. This tool is increasing the availability of comparable performance data across the provinces and territories. And thanks to Health Quality Ontario's home care indicator reporting, Ontario is the first and currently only province to report publicly on home care quality indicators. The second theme is health human resources. The supply of healthcare professionals in Canada has increased over the period between 2006 to 2010, and all jurisdictions are taking action on health human resources planning. The Model of Care initiative in Nova Scotia is a very good example of a successful partnership created to address staff shortages and fiscal challenges in that province's healthcare system. The real work in health human resources will be achieving the right mix of providers and helping healthcare professionals work to their full scopes of practice in teams. The Council of the Federation's Working Group on Innovation met last week to discuss scopes of practice, human resource management, and clinical practice guidelines. A focus on these 3 key initiatives will help to strengthen the performance of Canada's health workforce and enable a more sustainable Canadian healthcare system. Telehealth services have been successfully implemented in many areas. The use of telehealth has increased by 35% annually over the last 5 years. In 2010, over 5,700 telehealth sites were being used in nearly 1,200 communities across the country. Canada is at the forefront of telehealth in some areas, such as video technology, on par with others, such as home health monitoring, but behind in other areas. Of special consideration, we need to learn how to help transform our many pilot projects into sustained initiatives. While telehealth has come a long way, it is not clear how many Canadians truly have access to telehealth services. And it has been recommended that a standardized and systematic reporting system be developed to address this. One example actually worth highlighting is First Nations in Manitoba, who are benefiting from a partnership among various stakeholders, showing that by working together, it is possible to overcome many telehealth challenges, such as lack of broadband in remote locations and the high initial costs of setting up telehealth sites. The fourth topic covered in Progress 2012 directly relates to Canada's 3 territories: Yukon, Northwest Territories, and Nunavut. In 2005, the Territorial Health System Sustainability Initiative was established to help the territories improve access to care in the North. As part of this initiative, the federal and territorial governments agreed to some important goals, such as strengthening community-level services and decreasing reliance on the healthcare system. While the Territorial Health System Sustainability Initiative has spurred improvements in access to care in the North, the Health Council of Canada would also like to see attention paid to access to care issues in those provinces with northern and remote populations where citizens face similar challenges. And this brings us to our last theme, comparable health indicators. Despite the development of and subsequent reporting on comparable health indicators being a fundamental component of the 2003 Health Accord, governments reported on this topic for only a few years. Instead, public reporting on subsets of comparable indicators has been taken up by the Canadian Institute for Health Information, or CIHI, Statistics Canada, the Public Health Agency of Canada on behalf of provinces and territories. Overall, consistent indicators for many key areas of our healthcare systems are not measured, with provinces and territories preferring to measure their own performance using their own specific sets of indicators. As we said in our recent discussion paper, Measuring and Reporting on Health System Performance in Canada, it is clear there is a need for more comparable, pan-Canadian indicator reporting on health system performance. The federal health minister has suggested that we need to make the system more sustainable, improve accountability, and get better results for Canadians, and that we need an approach to measure and report performance across Canada's health systems. From the Health Council of Canada's perspective, a lack of clear and nationally consistent information about healthcare system performance continues to make it very difficult to provide Canadians with a comprehensive national picture of progress being made in healthcare delivery. A 2010 Institute of Medicine report entitled For the Public's Health, the Role of Measurement in Action and Accountability found that in the United States, the absence of a robust and available set of comparable health indicators makes it nearly impossible to hold the health system accountable for improving population health. To create the future we want, we must commit to changing how we do business today. Clearly, we need better ways to set goals, measure achievement, and identify gaps in healthcare delivery right across Canada. Governments need to harness the existing data collection and measurement capacity of CIHI and Stats Canada, as well as that of provincial health quality councils and related agencies to provide comparable pan-Canadian reporting on progress towards joint federal, provincial, and territorial healthcare goals. Why is this so important? Well, first, because an improved approach to health goal setting and performance measurement in Canada would allow independent monitoring agencies such as the Health Council of Canada, provincial health quality councils, and health advocacy organizations the ability to better report and compare against set targets and goals. Second, this progress report would be more complete and provincial reporting could become more transparent and comparable. Third, governments in turn would benefit from an independent assessment of progress and could take corrective action if it was found wanting. And fourth, the Canadian public would benefit by knowing that their governments want to be open and accountable for their role in improving the overall health and well-being of Canadians. Our overall review of progress towards meeting the commitments made in the Accords is this. Provinces and territories did most of what they set out to do. However, the efforts to date have not brought about large-scale and consistent change across the country. Unfortunately, governments did not set out clear parameters for change in the 2003 Health Accord or the 2004 10-year action plan, or the type of reporting that would be useful to the jurisdictions to actually measure such change. Instead, the evidence suggests that most commitments were vague and set with low expectations, and were in place to more or less put all provinces and territories on an equal footing instead of pushing them towards excellence in healthcare. These vague commitments, paired with the lack of comparable indicators, do a disservice to Canadians who deserve to know how their healthcare system is really doing. As was echoed in the recently released Senate committee report, Time for Transformative Change, to hold health system leaders accountable for performance, clear policy goals must be set and linked to both measurable health outcomes and supporting health indicators. Although health data collection and reporting have improved, only limited steps have been taken towards establishing a more comprehensive and strategic approach to improving accountability for healthcare spending and performance right across the country. Once we have comprehensive strategies in place, complete with concrete targets and strong leadership, that's when we will see real progress take place. Thank you.
You can download Progress Report 2012 Healthcare Renewal in Canada at our website, healthcouncilcanada.ca/pub/progress2012.